Hi everyone, my name is Dr. Surakshith Battina. I'm an endoscopic surgeon, a fertility expert, and a cosmetic gynecologist. We need to talk about what exactly is unexplained infertility. What is infertility is that if a couple, that is a man and a woman, are trying for sexual intercourse that is without any protection, non-protected sexual intercourse for 1 year, but they do not have any pregnancy, then they are deemed as infertile. That is, they have tried for a year on the right days of ovulation, that is on the 12th day, 14th day, and 16th day every month, but they have not still have a pregnancy. They are called as infertile. And when these people have gone and they have seek treatment and they have tested themselves. The man has a normal sperm count. The woman has a normal uterus. The woman has normal hormones and the normal number of eggs. Then at that point of time, we call them as unexplained infertility. Is that many women who are having unexplained infertility have some bit of explanation which we can do after doing something called as a diagnostic hysterolaparoscopy, which is nothing but the gold standard for women who are suffering from unexplained infertility. Whereas we put in a telescope, we see inside the uterine cavity. We look for small factors which might be playing a role in having her unexplained infertility. For example, sometimes when we see inside the uterus, the woman's uterus might look normal when we are looking at in the scan, because the scan is only a two-dimensional view. But once we put the telescope, we can exactly see how the cavity is. And usually during these times, we find small indentations, we find small issues which can be corrected then and there, and that will improve her chance of fertility. The same thing when we look from the tubes, I mean, from the laparoscope as well, we have seen that some of these women, the tubes might be normal, like they have a normal flow of fluid through the tubes, but some of the tubes can have something called as sacculations, that there are small sacs which are there in the tube. So all of these things we can, come to an understanding. And of course, very importantly, endometriosis. We have also seen a lot of women who all the tests are normal, but once we put in a telescope, we see everything is stuck inside because of endometriosis. And I'm sure this is some concern, a concern for a lot of younger women nowadays, because we have seen that endometriosis. When I was doing my PG, I have not even seen one patient with endometriosis. Now, every third or fourth patient I see has some kind of endometriosis, and that's the way things are going. So, going into the future, a lot of men and women are going to be suffering from unexplained infertility. I think this is very simple. Of course, you realize that you are infertile once you have tried for a year, but you are not having any pregnancy. And then when you go and seek treatment to your consultant and they have tested everything and everything comes out to be normal, that's when you realize you are having unexplained infertility. And that is when you have to go to the next step in your treatment protocol. For unexplained infertility, I think the gold standard is a diagnostic hysterolaparoscopy. Well, there is, of course, the other alternative where we take the eggs outside, we take the sperm outside, they make the pregnancy outside, and then they put the pregnancy back into the uterus, which is also known as the ICSI, or intracytoplasmic sperm injection. And these are usually reserved for couples who are a little bit older, maybe they are 35 plus and they are suffering from unexplained infertility. Then we really don't have time to experiment and see whether everything is normal or do a laparoscopy and things like that. So at that point of time, we would ask them to go in directly for ICSI. So their options are quite narrowed down, and it all depends only on their age. If in case we do a diagnostic hysterolaparoscopy and we find out exactly where the problem is, and as I said, once we find these issues, we are usually able to rectify them then and there. And of course, we are able to find out issues like sacculations and things like that, which are also found in all the fallopian tubes. So at that point of time, we know that if in case the egg is releasing on the side where the sacculations are there, then the chances of them to conceive naturally will be lesser. So all of this we can monitor, and all of this information we will have, so that we can titrate and we can plan a personalized treatment protocol for that patient. And once you personalize any treatment for the patient, then their chance of conceiving naturally will be much more higher. We cannot prevent it, unfortunately, because unexplained infertility can come to anybody. And in fact, I see the most frustrating situation which a couple can face is only unexplained infertility, because even if they have a particular issue, they're able to blame that particular condition for what they are having. But if they're having unexplained infertility, it's a big question mark. It's not only for them and for the doctor. In medicine, doctors hate the word unexplained. In fact, you will not see the word unexplained in a diagnosis for anything in the whole human body except for this unexplained infertility. Because at the end of the day, you need to give the patients an answer. You need to tell them why they are suffering from this infertility. And because we have tried everything else and we are not able to get to the answer, and that's the reason why in medicine there is only this one reason which is still this one condition which you still say is unexplained, and it is a part of the diagnosis as well.